Okay, let's dive in. Imagine this. Predicting disease outbreaks before they really take hold. It sounds a bit like science fiction, doesn't it?
It really does. But it's becoming, well, much closer to reality now, especially with AI.
Right. With how AI can chew through massive amounts of health data, it seems like we're on the cusp of something big.
Absolutely. And what's really fascinating, I think, is that shift you mentioned. We might be moving away from a public health model that's mostly reactive,
Responding after the crisis hits.
Exactly, to something much more proactive, trying to anticipate problems before they spiral out of control.
And that's exactly what we're getting into today in this deep dive. We're looking at the material you shared on using health data for epidemic forecasting, specifically predicting outbreaks with AI. Our mission really is to unpack how AI actually uses this health data for forecasting, look at the opportunities which seem huge, but also, face the real challenges involved.
Yeah, and epidemic forecasting itself, it's a really key part of public health surveillance. It's fundamentally about using the data we have.
All kinds of data.
All kinds, yeah, to try and predict how diseases might spread, to anticipate outbreaks, understand their potential impact, hopefully before they get too big.
Okay, so let's get into the nuts and bolts. How does AI actually do this? What sort of information is it crunching?
Well, this is where it gets really interesting. The power of AI here isn't just looking at the usual stuff like electronic health records, EHRs.
Right.
It's AI's ability to pull together and analyze a much, much wider range of data sources, all at the same time.
Like what? What else besides the clinical records?
Think way beyond the doctor's office. AI algorithms can sift through social media posts, news reports, public health data sets, even satellite imagery sometimes.
Wow, satellite imagery. Okay.
Yeah. And analyzing these huge, really varied data sets lets the AI spot maybe subtle patterns or emerging trends that you'd just completely miss if you were only looking at EHRs, for example.
Okay, so that's a key difference. It's not just about digitizing the old ways of tracking disease. It's about incorporating these entirely new signals, these maybe weaker signals from unusual places.
That's a great way to put it. And spotting those unusual patterns, especially from non-traditional data, that's tied very closely to something called syndromic surveillance.
Syndromic surveillance.
Right.
Can you break that down a bit for us?
Sure. So syndromic surveillance is all about trying to detect potential outbreaks really early, before you have a confirmed diagnosis.
Wow.
By looking at non-specific health data, like maybe a sudden spike in people searching online for flu symptoms in a certain area, or more people buying cough medicine, or even just the types of symptoms being reported to emergency rooms, things that suggest something might be happening but aren't a definite lab confirmation yet.
So you're looking for the smoke, not waiting to see the fire, essentially. Patterns in symptoms or behaviors.
Exactly. And AI just puts this on steroids. It allows for real-time analysis, data mining across all these different types of records we mentioned. AI can, for instance, quickly look for common exposures among groups of patients who report similar symptoms, even if they don't have a formal diagnosis. It uses what's called multimodal learning to screen EHR data alongside things like social media chatter or news reports. It helps spot potential disease clusters much, much faster.
So this is crucial for early detection then?
Absolutely crucial. It means public health officials aren't just waiting for confirmed case counts to pile up.
Right.
They might get a flag from the AI saying, hey, there's an unusual cluster of respiratory symptoms being reported here, or look, online chatter about stomach bugs just spiked in this town. It allows for a much more proactive investigation.
That completely changes the game, letting officials get ahead of the curve.
It really shifts the timeline. And, it's not just about detecting outbreaks earlier. AI is also becoming critical for the forecasting itself and for planning the response.
Okay, so moving beyond just spotting it to predicting how it might unfold.
Yeah, we're talking about quite sophisticated AI-powered systems for pandemic resource planning and modeling.
Modeling systems. What are they actually simulating? What goes into those models?
They simulate how infectious diseases might spread through a population. They build these complex models that consider all sorts of transmission dynamics, things like population density, the impact of interventions like social distancing, or maybe mask mandates.
Vaccination rates, too, I assume.
Oh, definitely vaccination rates, travel patterns between regions, lots of different factors depending on the disease and the model.
And what's the practical output? What do public health agencies actually get from running these simulations?
This is where it becomes incredibly useful for preparedness. Based on how the simulation plays out, The system can predict the likely demand for critical healthcare resources down the line.
Okay. So not just cases, but the impact of those cases.
Exactly. It can forecast the need for, say, hospital beds, ICU beds, ventilators, specific medical supplies, even how many doctors and nurses might be needed in different places at different times.
That sounds incredibly valuable for planning. You can see where the potential strain might be before it actually happens.
It's huge for strategic planning and resource allocation, getting resources to the right place before the system is overwhelmed.
The sources mentioned a real-world example of this, didn't they, in India?
Yes, that's right. The material highlighted a national task force in India that used an AI-powered pandemic modeling system during the second wave of COVID-19.
And it helped.
Well, the idea was that it helped predict the spread and the associated resource needs. This, in turn, could assist the government in mobilizing those resources, potentially preventing shortages of things like oxygen or beds. It shows how these aren't just theoretical models. They can provide actionable insights.
Okay, so the potential is clearly massive. Earlier warnings, better resource prediction, much more informed planning. But AI and health data, especially across complex systems, that always brings up major hurdles, right?
Oh, absolutely. It's definitely not straightforward. The sources we looked at are quite clear about the significant challenges that need to be tackled to make this work effectively and ethically, especially in, diverse settings.
Yeah. Where do we start? The data itself seems like a big one.
It really is. A fundamental challenge is just the quality and availability of the data. AI models are hungry for data, and they work best with comprehensive, standardized, reliable information.
Which is hard to get in healthcare.
Often, yes. Health data is frequently siloed in different systems, hospitals, clinics, public health agencies, and it's often stored in different formats, making it hard to pool together and analyze effectively.
And that connects directly to the interoperability issue, I guess, making these different systems talk to each other.
Precisely. Interoperability is crucial. Different health IT systems need to be able to exchange data securely and seamlessly. This is a major headache pretty much everywhere.
Is there a way forward on that?
Well, the material recommends using data standards. Specifically, it mentions FHIR, that's FHIR, Fast Healthcare Interoperability Resources. Using standards like FHIR can make data exchange much easier.
Right.
Think about the logistics of something like the COVID-19 vaccination campaigns. The sources pointed out how difficult that was because patient records were scattered across so many incompatible systems. Interoperable records, based on standards, could potentially streamline things hugely, reducing workload and costs.
Okay. Data quality, interoperability. Now, the really big one, whenever you talk health data, privacy and security. How do the systems described handle that? It seems paramount.
It absolutely is, and the sources draw a very important distinction here. For systems like the ABHA mentioned, the control rests firmly with the individual patient.
Meaning
only the individual can choose to share their own health records, and they have to give explicit consent each time. Your personal health data isn't shared unless you say so.
Okay, that's clear for personal record sharing. But what about using data for that broader public health surveillance we talked about, for tracking outbreaks or informing government policy?
Right. For those specific public health purposes, things like government policymaking or interventions in the public interest, the sources state that anonymous records can potentially be used by the government.
Anonymous records, so data stripped of personal identifiers.
Yes, aggregated and anonymized data. But, and this is a really critical but, this use of anonymous data is only permitted after very clear, robust protocols for how that anonymization and aggregation will happen are defined. And these protocols need to be developed through consultations with stakeholders.
That's not happening yet.
The sources explicitly state that until those protocols are properly defined and agreed upon, health records are not used in this way by the government. This clear line between consent-based sharing of personal data and protocol-governed use of anonymous data for public health is absolutely vital for building and maintaining public trust.
That makes sense.
Okay.
People need to trust the system. What about biases in the AI itself? Is that a concern?
Yes, definitely. The sources also raise the issue of algorithmic bias. AI systems learn from the data they're trained on, and if that data reflects existing societal biases, maybe certain groups are underrepresented in health data. For example, the AI might inherit those biases.
Leading to what?
It could mean the AI unfairly targets certain groups. Or worse, maybe it misses early signs of an outbreak in other groups because it wasn't trained well on their data patterns. Ensuring fairness and equity in these algorithms is a major ongoing challenge.
And then there is just the practical issues of rolling these systems out, especially everywhere, not just in big cities.
Absolutely. Implementation hurdles are real. The sources mention language diversity, for example. In a country with many languages, like the context implies for India, the systems need to support multiple languages to collect and analyze data accurately from everyone. And then there's basic infrastructure, things like reliable internet connectivity, especially in rural or remote areas. If the data can't flow consistently from local clinics or health workers to the central AI systems, then the whole model breaks down. That digital divide needs to be addressed.
So it's quite a list. The vision of AI predicting outbreaks is powerful, but getting there involves tackling data quality, making systems talk to each other, navigating really complex privacy and ethical lines, fighting bias, and even ensuring basic internet access. It's not simple.
No, it's definitely a multifaceted challenge, but the potential upside, the payoff in terms of better public health preparedness and faster response, it's just enormous. If we can harness AI responsibly, if we can put those robust frameworks in place for data, privacy, and ethics, then AI really can give public health officials incredibly valuable, timely insights. It lets them shift from being reactive to being much more proactive.
It really does feel like a potential paradigm shift, moving away from just responding to crises towards maybe anticipating and mitigating them before they fully hit?
Exactly. By tackling these challenges, the data, the interoperability, the privacy, the bias, the infrastructure public health systems can become, well, more resilient, more efficient, and just fundamentally better equipped to protect communities.
It paves the way for a future where maybe we can see health challenges coming and actually prepare effectively.
It forces a rethink of what preparedness even means.
Which brings us to a final thought for you, our listener, to chew on. Based on all this, how does this potential shift from primarily reacting to outbreaks to maybe predicting them? How does that fundamentally change the day-to-day role and responsibilities of public health in society? What new questions pop up about resource allocation or how we communicate risk that go beyond even the crucial privacy issues we discussed? Something to think about.